How does urothelium affect your bladder function? Have you ever wondered how the inner lining of your bladder impacts its function? The urothelium is a fascinating and vital component of bladder health. It lines the inner surface of the bladder and the urinary tract, serving multiple essential roles. First and foremost, it acts as a protective barrier. This barrier prevents urine and harmful pathogens from penetrating into the underlying tissues and bloodstream. The outermost layer of this lining consists of specialized umbrella cells. These cells can stretch and flatten as the bladder fills and empties, allowing it to expand without leaking. But the urothelium does more than just protect. It also functions as a sensory organ. It detects physical and chemical changes within the bladder. For example, when the bladder stretches, the urothelium releases signaling molecules like adenosine triphosphate, commonly known as ATP. This releases activates receptors on nearby nerve cells, communicating the bladder's fullness and triggering the sensation of needing to urinate. The urothelium contains various receptors, including purinergic receptors and muscarinic receptors, which play a role in these sensory processes. Additionally, the urothelium influences the contractile behavior of the detrusor smooth muscle, which is responsible for bladder emptying. It modulates how this muscle contracts and its spontaneous activity through chemical signals. This regulation is crucial for coordinating proper bladder filling and emptying, ensuring that we can hold urine until it is convenient to go to the restroom. When it comes to bladder health, the integrity of the urothelium is essential. Damage or changes to these cells can lead to increased permeability. This allows irritants or pathogens to penetrate, potentially causing inflammation or infection. Such disruptions can also affect sensory signaling, contributing to bladder disorders like overactive bladder syndrome or painful bladder syndrome. Furthermore, since bladder cancer often arises from urothelial cells, understanding the biology of the urothelium is vital for early detection and treatment strategies. In summary, the urothelium significantly affects bladder function by acting as a stretchable barrier, serving as a sensory organ, and modulating bladder muscle activity. Maintaining a healthy urothelium is crucial for normal bladder function and preventing urinary tract diseases. If you have concerns about your bladder health, it is always best to consult a healthcare professional for personalized advice.